Doctors Without Borders is calling on governments worldwide to support a call by South Africa and India. Both countries have called on the World Trade Organization to allow countries to bypass patents and intellectual property on COVID-19 related drugs. Doctors Without Borders says companies must not profit from these drugs while the world still faces a pandemic. Candice Sehoma from Doctors Without Borders joins me live now from here in Johannesburg. Candice, thank you so much for joining us. This call by South Africa and India just this week, how significant is it to come from two governments who are in the midst of fighting this pandemic?
Yeah, so thank you for having me. So as you mentioned, that South Africa and India submitted a joint communication to the TRIPS Council last week at the World Trade Organization, which is a waiver titled Waiver from Certain Provisions for the TRIPS Agreement for the Prevention, Containment and Treatment of COVID-19. So what this waiver means is that it would allow countries who are WTO members to choose to neither grant nor enforce patents and other intellectual property related to all COVID-19 drugs, vaccines and diagnostics and other technologies, including masks and ventilators. This would provide countries with the policy space needed to collaborate in research and development and manufacturing, scaling up and supplying COVID-19 tools, especially considering that there's been, vast amounts of shortages when it comes to access to these essential life-saving tools, medical tools. So this proposal that has been made by South Africa and India would allow that policy space for countries like South Africa and India, who are developing countries who don't have the resources to buy in numbers as your high-income countries. It would allow them the space for them to also be able to manufacture based on their capacities.
Now, obviously, at this moment, those patents are being enforced and other intellectual property rules and regulations are currently being enforced. What kind of impact has that had on this fight against this pandemic?
It has a very great impact, especially, considering that, your low and middle income countries are at the receiving end and are very vulnerable. As I'd mentioned, that countries like South Africa don't have resources as much as, say, your UK and the US, who have managed to sort of secure vaccines, even though they're not sort of proven effective. They have put money, like large amounts of money, to secure vaccines once a vaccine has been proven effective. Countries like South Africa or low and middle income countries are at a very vulnerable state that they'll probably be at the end of the stick if they were to, in terms of accessing a vaccine, So it has a vast impact. I think another example would be also the remdesivir, which is the only drug that has been proven, or rather that has been qualified to be used for the treatment of COVID. Countries like us, the US has managed to secure quite a lot of those drugs, leaving a lot of countries, even high-income countries, out of stock and not being able to access these drugs. So it does have a huge impact, and I think it also speaks to the reality that our global capacity cannot meet the demands that we are currently having, and these patents would allow that space for countries like South Africa, who have, that capacity to manufacture medicine, to be able to do so to meet their local demands.
Well, speaking about manufacturing, what are we hearing from the pharmaceutical corporations? Because obviously this problem wouldn't be an issue if they showed some kind of willingness to soften their approach during these very difficult times.
Yeah, and I think it's also quite an unfortunate thing that, pharmaceuticals are continuing business as usual. They're still profiteering out of a pandemic. The people are dying in numbers, but they still consider making profits far more important than saving lives. And we can't rely on them, actually. We can't rely on pharmaceuticals to come forth for us. And hence we need these policies. We need these policies to actually enforce and obligate these pharmaceuticals to act in accordance and actually prioritize and safeguard public health over making profits. And yeah, so I think it's quite an unfortunate thing that pharmaceuticals are actually, for them, it's just a party to make more money, and and also we can't also rely on their good, because we have seen even during the height of the HIV and AIDS pandemic, the same was happening, and today we're still facing the same thing. So we cannot rely on pharma to
do the right thing, as it were,
because they will not. Yes,
yeah,
exactly.
Candice, before I let you go, what happens next? We've had this call from South Africa and India. Your organisation is supporting it. Do we now wait to hear from the WTO? I believe there's a big meeting happening on the 15th of October. That could be quite important.
Yes, so there is a meeting the 15th and 16th of October, but it's also quite a long process. It doesn't end on the 15th and 16th. And what we're trying to do is trying to mobilize countries to support South Africa and India, and not just your developing countries, but high-income countries to be in support of these countries. We're also calling on the African Union, these continental bodies, to also be in support, because it can only go so far if we just have two countries in the forefront of this. And I think there is a need for global solidarity, and one of the ways that can be showed is by supporting this call from South Africa and India.
Thank you so much for that. That's Candice Sehoma. She is with Doctors Without Borders.